We've got Wright Lassiter of Henry Ford Health Systems, John Fox of Beaumont Health, Tina Fries-Decker of Spectrum Health, Ed Ness of Munson Healthcare, Brian Peters of the Michigan Health and Hospital Association, and Gar Atchison of the UP Health System. So we're with you this morning because our state is now in a phase of exponential increases in both COVID-19 cases and COVID-19 hospitalizations. And I think it's fair to say that a slowdown is nowhere in sight. So over the past 5 weeks, the average weekly growth rate in cases has been 40% per week. Well, a 40% per week increase rate implies that cases double every 2 to 2.5 weeks. And that is exactly what we've seen. Over the last 5 weeks, cases in Michigan are up more than fivefold. So they rose from just over 1,100 per day in early October to nearly 6,000 per day most recently. And COVID-19 hospitalizations are on a similar pace of increase. They've increased fivefold, actually over fivefold, over the last 6 weeks. But more concerning is the doubling time for hospital cases. The doubling time is now just about every 2 weeks. And at that pace, these healthcare leaders project that we will top our Michigan spring hospitalization peak late this month. Now, one difference is that these cases are spread across the state versus being concentrated in the Southeast, but nonetheless, this rate of increase is, as you'll hear, pressuring healthcare systems and frontline workers across the state, and that's only going to intensify as these cases and hospitalizations continue to rise. And so I think you'll hear from the leaders on this call that our situation in Michigan is once again headed to a place that is going to be very painful for our state unless we take personal responsibility, all of us across the state, to slow spread. And with that as an introduction, I will turn it over to John Fox, who's going to kick things off for us this morning.
Thank you, Jerry, and thank you all for joining us this morning. As Jerry indicated, we're dealing with a very, very serious situation. For Beaumont, we have 9 ERs and 25 urgent care centers. Our volumes are all way up, particularly with testing volume. As Jerry indicated, the positivity rate is up substantially. That means that we in our communities are transmitting the virus much faster between each other than we were 30, 60, 90 days ago. And it's accelerating. It's an accelerating trend. It's very serious. In terms of our inpatient volumes, which is a lagging indicator, and you got to watch out for that one, the virus is, that tells you how much the virus spread 2 weeks ago rather than the current situation. Our inpatient volume has now tripled with COVID-19 in less than 30 days. We are now over 400 across our 8 hospitals with COVID patients. And again, that is accelerating. I will tell you that one of the most difficult things is getting people to use the basic tools of infection control that will protect people from the virus, particularly a mask. It's a difficult situation. People do not appreciate. We see it out in the community. We see it in our own lobbies. As people come in, we ask them to wear masks to do the basic protective activity, and we get resistance. We have to work that through. And again, this is a controllable pathogen if we do the basic infection control steps of masking, social distancing, and hand hygiene as your big 3, and we can turn this around. But at the current rate, it's not turning, and it could be a much more serious situation. So with that, I'll probably turn this over to Tina Fries-Decker. Thank you.
Thank you, John. And again, thank you all for joining us today. I want to start first with just my gratefulness for our physicians, our nurses, and caregivers who are working tirelessly in our hospitals and our healthcare facilities to care for the communities that we all serve. And so we thank them so much. What we are trying to do is continue to slow the spread and flatten the curve so that we can continue to care for patients and people within our community, not just COVID-19, but for every healthcare situation. What we are seeing is very similar to what John Fox said. We do about 4,000 tests a day, and it's about 15% positivity rate. Just 2 months ago in September, it was at 3%. So it's a much different situation than we had a couple months ago. We're also seeing that this is throughout the state, and so that's a concerning piece because that's much different than it was in the spring. But one of the good news is that we aren't seeing the demographic disparity that we did see in the spring. It is infecting all populations. And so that's why it's critical for us to come together as communities to practice the things we know that work, but also limit the in-person gatherings so that we can flatten this curve and continue to care for our communities. And now I'll turn it over to Wright Lassiter.
Wright, are you on? It's over to you.
Thank you. My apologies. Good morning, Wright Lassiter, Henry Ford Health System. The story is the same at Henry Ford, as you've heard from my colleagues at Beaumont and at Spectrum. In the last 14 days, our COVID admissions have risen by 128%. And so we're seeing significant escalation across all of our Southeast Michigan hospitals and our Central Michigan hospitals. We have a significant burden in our emergency departments, as you heard from John Fox. Similar to the story that you just heard from Tina in Grand Rapids, the positivity rate for patients being tested in Henry Ford laboratories has risen extensively. As of this morning, it was 16.4%. Not unlike what you heard from Tina Fries-Decker, just weeks ago, it was in the low single digits. And so it's very, very clear that we're seeing something different. We're seeing a significant escalation in the community spread of COVID-19 across all portions of Michigan, as you'll hear today. I would say to you, as you've heard from our colleagues, while there's no silver bullet for COVID-19, we clearly know that some things work. We clearly know that wearing masks works. We clearly know that social distancing helps. We clearly know that hand hygiene helps you remove pathogens from your hands. And we clearly know that removing yourself from large gatherings where the spread is possible will help. We're here this morning asking all Michiganders to support our essential workers in healthcare with the kinds of practices that will help us help you. But lastly, just say that Henry Ford Health System was one of those systems hit very, very hard in the spring. At our peak, we had 1,000+ patients across our system. And so while today isn't like that, there's one significant difference that I do want all Michiganders to understand, and that is, we've been in a battle for the last 8 months. And when you're in a battle for that long, you lose a bit of energy, steam, and resiliency. I would tell you that the amazing physicians, nurses, and other healthcare workers, essential workers that work in our healthcare systems are working tirelessly on behalf of the state of Michigan on a day-to-day basis. I ask you to help them in not having to have the volumes return as they were this spring. Thank you very much. And I'll now turn to Ed Ness from Munson Health.
Thank you. One of the I would say the statistics in northern Michigan and Traverse City in northern Michigan are very similar to what you see or heard in other parts of the state. We have seen our percent positivity rate almost triple over the last 4 weeks, and our census of our community hospitals go up by almost 4 times. What is different than back in March and April, where this was a situation that was really focused in the Detroit and urban areas, it is now throughout the state. And we are seeing the same spikes that we're seeing in our urban areas. I think and because it was isolated before, I think some of our rural communities felt that they're isolated, that they're protected from this issue. And our recent data has shown that it doesn't matter where you live, we are facing the same situation. And so one of our messages to Northern Michigan is, even in our rural communities, you have to be diligent, you have to wear masks, and you have to be cognizant of limiting the size of social gatherings. One of the other things I think that is unique about our rural communities is the lack of safety valve. You know, it is 2.5 hours from Traverse City to Grand Rapids, which is the next biggest system. And that's quite a burden to families for transfer of patients and for care. So really the same messages as we see outbreaks in the Upper Peninsula, put pressure on their downstate hospitals. It is now more than ever a time for our communities and our citizens, whether that's in the rural area or the metro area, to really take precautions so we can bend the curve. You know, as you know, in smaller hospitals, they are the only hospital in a community. So there isn't safety valves. And so we really need to be cognizant to bend this curve to protect our staff and to protect our community. So thank you.
Hey, Brian Peters, you're on, I know, and you have a view through the MHA to facilities all over the state. Maybe you could add a view to geographies that might not be directly represented.
Thank you very much, and good morning. And I did want to begin by acknowledging Jerry Anderson and Nancy Schlichting for their terrific leadership of the Michigan Economic Recovery Council, which has really brought healthcare, academia, and business together to fight this COVID-19 pandemic. I can tell you that the Michigan Health and Hospital Association does represent all of the hospitals and health systems throughout the entire state of Michigan. And our mission is to advance the health of individuals and communities. So it's from that vantage point that I can tell you very clearly that we are squarely in the midst of a public health crisis. You've just heard from several of our health system leaders throughout the state. I can tell you that on a daily basis, we are getting feedback, both anecdotal evidence and data, from both small rural hospitals, our large urban systems, and everything in between, from literally every region throughout the state of Michigan, that is consistent with the message you have just heard. In other words, our hospitals are rapidly filling with COVID patients at a very alarming rate. If this continues in the coming weeks, we will surpass our all-time record high in terms of COVID inpatient hospitalization numbers here in the state of Michigan. And so we are truly here today as a group to call on all Michiganders to do the right thing. You've heard about the big three, as John Fox alluded to, of masking, social distancing, and appropriate hand hygiene. Truly, we need all Michiganders to do those big three activities to help our frontline caregiver heroes as we combat this terrible virus. And I'm very optimistic that if we do come together in that regard, we can be successful at the end of the day in curbing the spread of COVID-19. But we need to take this very seriously, because not only are the numbers alarming, people are dying. Michiganders need to understand how serious this virus truly is. Thank you, Jerry.
Thanks, Brian. And Andrea, I think maybe we'll go to Q&A now, although I would just make sure the press knows that Gar Atchison, who has exposure to the systems in the Upper Peninsula, is with us as well. And that's one of the geographies that's been affected in this round that really was lightly affected in the spring. And so, Gar, we thank you for being with us. And with that, Andrea, if you could lead us through Q&A, that would be great.
Absolutely. I'm ready to get started. I know I had a few of you message me before asking to ask questions. This is your chance. Who would like to go first? Please go ahead and give me a signal. Zach Gorchow from Gongwar.
Hi, good morning. Thank you for doing this call. Is calling on residents to do the right thing enough, or based on what's happened in the last month, is it going to be necessary for the government to step up its restrictions, requirements? Do we need a new, everything from tougher penalties for if people don't wear masks to a stay-at-home order? I mean, what is it really just asking people going to be enough, or would you like to see the government take stronger action?
Does any one of the healthcare leaders want to jump in on that one?
I'll jump in. It's a great question. I think none of us want to go through the shutdown and the brute force of what happened in the spring. I think we don't need to do that. But I do think that government and frankly all of our communities play a critical role in reinforcing the way that we can control this virus. The virus doesn't move on its own. It spreads through us, our behaviors, our patterns. The tools to control it are there. They're all accessible. And we just have to constantly emphasize that in any and every way we can. I don't think any of us want to see a lot of regulation drop down on business and social activities and other things. But we can't be tone deaf to the reality of this virus and its massive impact it can have clinically and otherwise on Michigan. This is a very serious situation.
So, Jerry, I would just comment as well. I agree with John's comment in general, which is I think we all would agree that just having a blanket shutdown is sort of a blunt object that does not provide the specificity that we need. I think that it remains to be seen whether or not simply asking Michiganders will be enough. And I think that's where we stand currently. That if doing the right thing and using ration and science isn't sufficient, then there may be other steps that end up being necessary. But would agree with John that those steps would not be effective simply to have a broad-based shutdown, but to look very specifically at where cases may be happening and are there measures that could be taken in very specific places.
I just add that we've been watching this case rise occur in other countries and in other states ahead of us generally. And what we have seen there is that when cases get on the pace of increase that we're seeing now in Michigan, those countries have not reverted to the sorts of broad economic shutdowns that they did in the spring. Everybody did in the spring because we simply didn't understand the virus. They've been much more targeted where government did intervene. And generally they've intervened to shut down social interactions because that is where the spread is occurring. Generally, businesses are finding that cases are coming into the workplace from social settings or from home settings. And so when you look in Europe, for example, the interventions that government have made have been, as these healthcare leaders have said, very targeted and generally around trying to contain social spread. Now that's really a decision state government will need to make, but we're at a very serious phase.
Thank you. Victor Isaiah. Go ahead and unmute. Thank you.
Yes, thanks a lot. Are you guys at all concerned about becoming, I guess, at full capacity all across the board with all the hospital systems? I know before there were times where if patients aren't able to go to one hospital, that they're able to go to a different one to be seen by a doctor. But if both hospitals or all the major hospitals are at full capacity, then what happens then?
So, I would just say that's one of the general concerns that I think we all have. And I won't speak for my other colleagues, but I would just simply say that because we're seeing significant hospitalization across the entire state, it gives us great concern that if the case escalation continues on this same pace for significantly longer, you will have every hospital getting to its capacity and having to make decisions about slowing down and or discontinuing some kinds of basic care to care for COVID patients. And so, as you'll recall, in Southeast Michigan, when we got to that place, we had to lean on state and federal government for field hospitals to provide a backstop for Southeast Michigan hospitals because we were at our breaking point. And we're all hopeful that we won't get there again. And we're all hopeful that won't be a need, but that is a scenario that could play out if there isn't a change in behavior and thus a reduction in the escalation of cases that we see across all parts of the state.
Yeah, I would just add that I agree with Wright. I think one of the things that is different about this period of time compared to March and April is this is throughout the state. The capacity issues are in the UP, they're in northern Michigan, and they're in all of our communities. And so it provides fewer safety valves for transfer of patients to maybe lower hit communities than we saw in March and April. And so it is a concern given the widespread nature of these surges.
And I would say that we've learned a lot from the time period that we've been working with COVID. And so we do know the measures that we are taking to expand in our current facilities to make sure we can take care of patients inside our own four walls. But as Wright and Ed has said, the concern is that it is everywhere in Michigan. It's also spreading throughout the Midwest. And so having spaces to go is one thing. The other concern we have is just our team members. As Wright said, our team, they've been dealing with this for a very long time, so they are tired. They're doing an exceptional job right now, but we also know that they may be getting sick, whether it's from a family member. And so we want to make sure we're keeping them healthy as we go through this, because it may not be access to a facility need, it may actually be staffing. And when all of us have the need, that will be the critical resource that we'll be looking for.
I would just reiterate Tina's point that really it's the staffing concern that's risen to the top of the list from our hospital members throughout the state. In other words, we're in a good place, a much better place now than we were earlier in the year when it comes to our supply of personal protective equipment. That was at a crisis stage, as you may recall. So we're in a better spot there. We certainly have taken advantage of our surge capacity plans to add inpatient capacity where that makes sense. So it's not necessarily an issue of lack of hospital beds, but it truly is a very concerning issue when you talk about availability of staff, particularly if frontline caregivers are testing positive themselves. So that has clearly been our top concern.
Thank you. Next is Robin Erb.
Hi, thanks for doing this. These are some bleak numbers. Can I ask a question for Guy or Gar or Atchison? Could you describe a little bit exactly what you're seeing in the UP? I mean, your hospital is getting pretty full there. Is it from Marquette? Are you pulling from other areas? Kind of describe what's happening with the hospital systems in the UP.
Yeah, so the hospital, yeah, thank you. And thank you for inviting me. The hospital systems in the UP are really working as a collective unit dealing with the COVID-19 rise. We are seeing some pretty rapid increases with some pretty alarming case rates. Some of our testing centers, are running 30% multiple days in a row of positive rates. We are the safety net hospital for the Upper Peninsula. So it is a concern of us when we hit capacity and, Region 6 and downstate are full, what's going to happen then? So we are seeing most of our patients, especially in the ICU level care, coming from other counties, a lot from Delta. county down in Escanaba, which is having a very high positivity rate. So, you know, the UP hospitals, we have good bed capacity. ICU capacity outside of Marquette is fairly limited. So that's the number that I'm paying most attention to, is the ICU capacity. About 61% of the, well, exactly 61% of the patients in an ICU bed in the UP are there with COVID.
So much. Can I ask a follow-up question too about testing?
Sure.
I'm just wondering for anybody, you know, how is testing going in terms of being able to turn around results quickly? You know, obviously you prioritize or triage testing, you know, for the most critically ill, but just generally, how is testing going? Are you able to keep up?
Hi, thanks for the, yeah, I would just say
situation.
that, go ahead, John.
I'm sorry. I mean, it's a difficult situation in that the rapid testing, where you can get a turnaround in 2 hours, PCR testing is coming up in shorter supply as the government has to redistribute some of these test kits nationally. So what we're left with is more over-reliance on other testing platforms that can take a day to get the result back. And so that's a challenge in and of itself, albeit we have a lot more capacity on the longer turnaround tests. But the rapid tests, PCR test, not antigen test, is really the most valuable. And that is a resource that, for example, in Beaumont, we've been cut 20% by the government in the last 2 weeks as they've reallocated to other hotspots around the country.
There's rapid PCR tests, that number has been cut 20%.
Correct.
Okay. Thank you.
You know, so I would just say, just to follow up on that, you know, generally speaking, really until this week at Henry Ford, I would say that we had no significant challenges with being able to keep up. We just note that, and normally our turnaround time is just over a half a day for PCR testing. Would note that the report that I got this morning showed that as of yesterday, we were only able to complete 60% of our tests in 24 hours, and that was because of some supply shortages that we have on a short-term basis. And so we are starting to see some challenges similar to what John indicated in terms of the supplies not coming to us in the same quantities that we had previously prior to this week.
The testing capacity that we have in the state is much higher than we had in the spring. And so we've all increased that, but it's still, we need to do even more of it, because what I'd like to see is even faster turnaround times so that people get those results in less than a day or two, so that they can take action and be quarantined without having the worry or understanding of what's going on. So I think it is critical that we get more of these testing supplies within our communities. And I know that's an active thing that we are working on.
Thank you. Next is Karen Hopper-Usher.
From the Cadillac News. Hi, thanks. This is probably specifically a question for Ed Ness. I'm wondering what the ventilator situation is throughout Munson, specifically in Cadillac, if you can help me out there. And I'm wondering if we've managed to buy or build or get more ventilators across the state since the beginning of the pandemic. Thank you.
Thank you. Speaking for Northern Michigan, actually ventilator availability is not the challenge. One of the things that's different, and I think because we know more about how to treat these patients and we have different protocols, the percentage of, we have about 66 patients throughout Munson Healthcare that are in an inpatient bed. Probably 5 of those are on ventilators. And so it's a much smaller number than it was. So our concern is similar to that it is throughout the rest of the state, which is just overall bed capacity and staffing to take care of those patients that are in a bed.
I would just reiterate Ed's comment from a statewide perspective. We have approximately 3,000 Michiganders that are inpatient hospital patients today, COVID related. And of those approximately 3,000 people, 255 are on vents. So a relatively small proportion, particularly compared to where we were earlier in the year. As Ed alluded to, we've learned a lot and are handling this a bit differently now.
Next is Julie Mack from MLive.
Thanks for doing this. I know I was on a call yesterday with Tina Fries-Decker, and she mentioned that hospitals are pretty loath to go back to where they're cutting out services to non-COVID patients. And I would be curious as to what the stance is of other hospitals about elective surgeries and serving others in the hospital who do not, there was sort of a shutdown of the hospitals outside of COVID in the spring. My understanding is hospitals do not want to be doing that again.
So this is right, Lassiter. I would certainly echo Tina's comments from yesterday, which is, we clearly do not want to be in a position where we have to shut down elective procedures or non-emergent activities going on in our hospitals for two reasons. The first, which you've heard from Tina previously, and that is we don't want Michiganders to have to delay necessary care. And so we want to be available to the communities we serve for whatever care they need. And then secondly, the other practical issue as well is that it has a significant impact on the financial viability of our organizations. And so, we are obviously working very hard to ensure that, one, we can deliver the highest quality and safest care to patients, but also that we have financially viable healthcare institutions serving our communities. And so we certainly don't want to do that. I will say that at Henry Ford, we have not stopped any elective or non-urgent procedures. We are having a small percentage of patients who are opting to delay care because they're becoming concerned again about the level of COVID in hospitals. And I just say that to all consumers that hospitals are safe places. Our staff and our leaders understand how to ensure that we keep people safe and segregated between COVID and non-COVID patients. And so please don't delay care that's necessary.
I would just add to what Wright said that our infection rate within the hospitals and of our own personnel is less than the community rate, which says, this PPE does work. It does create a safe environment. We also are keeping all of our non-COVID services open. We believe that delaying those services puts people's health at risk, for cancer, neuromuscular issues, a whole bunch of clinical conditions. And we do not want to shut that down. Those patients need care, and we want to stay functional with respect to our whole spectrum of clinical programs across Beaumont. And that's our intent. And that's why we need the community's help, because if we can reduce the rate of where we're being presented with COVID patients, it enables us for patients to get cancer care. The OB service does not slow down at all with the pandemic and, all sorts of other clinical activities. So it's critical that we avoid that shutdown of other clinical services that we went through in the spring, because it has negative clinical outcomes for patients and families.
Yeah, if I can tag onto that, we look at it daily here in Marquette and have had to, over the last week to 10 days, move off some cases simply because of the ICU capacity. But going back to a shutdown, what we saw when we came out of the shutdown was acuity levels of patients. I'm sure all systems in the state saw this too. Acuity levels of patients that we hadn't seen before. The case mix index, once we reopened, was at record level highs because people had delayed care. And so then by the time they did present with, say, a GI bleed, it wasn't in an early stage. They were coming in far worse shape than we had ever seen before. So, shutting down does have consequences to public health that I think we all agree we'd like to avoid.
Thank you. Next is Dave Eggert from the AP.
Yeah, hi, thanks for doing the call. There was a mention earlier of field hospitals. How quickly do you think the state government and the federal government should move to set up those field hospitals, given that takes some time? And secondly, you mentioned about 3,000 people are hospitalized with COVID. what's the statewide hospital system capacity? I mean, at what point, do you hit capacity, and would it definitely need those field hospitals?
On the field hospital issue, and I'll let someone else speak on the capacity. I think Brian Peters may be best to do that. I think we in the government better remember that the rate limiter is not beds. The rate limiter is people to staff those beds. And so just building a field hospital with 500 mattresses in it doesn't get you staffed up. And the only way to staff up is to play a very problematic zero-sum game of taking staff away from somewhere else. So again, they have a use and they have utility, but I think sometimes people jump into the field hospitals as some sort of panacea and don't think through the fact that they all need to be staffed, and that is your real rate limiter.
Yeah, let me just highlight that with John. So I completely appreciate John's comment, and would just say that the significant difference between November and April is that we have COVID cases significantly all over the country. Effectively today, the entire country is a hotspot. When we had the need for field hospitals, we had, a dozen states maybe that were hotspots, and so you could draw from other places to staff the field hospitals, as John indicated. And so that is a significant concern, that there is so much COVID high case rates in so many states that there are not excess critical care nurses or other important personnel to staff additional beds in any area.
Yeah, I would agree from a Northern Michigan perspective. I think sometimes field hospitals sound like a good and easy solution. I would say in Northern Michigan, our issue is not beds. It would be having the staff to staff those beds. And so simply creating more beds without a plan, with outside resources to staff them, wouldn't help the situation.
We are clearly hearing a theme, which I would agree with. It's not the beds so much, it's the staff. I would say with respect to alternate care facilities, field hospitals, one concept that potentially could be helpful, again, if this came with the appropriate staffing complement, and that is we do have a number of COVID patients who have been treated in our hospitals but are now ready to be discharged back to a skilled nursing facility, but the skilled nursing facility is either unwilling or unable to accept those patients. It's creating a bit of a bottleneck for us. And so one concept would be that these alternate care facilities would be a potential landing spot for patients in that category. Again, if there was staffing to go with it. In terms of statewide capacity, we have approximately 26,000 licensed and staffed inpatient hospital beds. And we keep a very close watch on where we stand across the state in terms of the capacity, region by region, hospital by hospital. And we can certainly follow up with more specific data on that after the call.
Thank you. Next is Mike Beaumont with MERS.
Yes, I actually have two questions. The first is, your message today is you're calling on the general public to continue using masks and social distancing. I have to say that when I'm out in public, the vast majority of people that I see are already doing that. Do you have information, do you have statistics on what the rate of compliance is by the general public? And what do you think that number needs to get to in order to get this virus under control?
This is Brian. I would offer this perspective, which is, I agree when you're out in public at the grocery store, et cetera, you do tend to see people masking up. Our concern is that what you don't see is the small and medium-sized group gatherings indoors, these private gatherings, friends, family, colleagues that get together in these group settings. We aren't seeing that, but it's happening. Thanksgiving coming up is going to potentially be another example of what I'm describing, where you think because you know these folks they're in your circle of friends or colleagues, that surely that must be okay. And it turns out it's not okay. And so I think that's where the lack of appropriate masking and social distancing is really coming back to bite us. And I know there is a saying in business that culture eats strategy for lunch. I think the parallel here is, regardless of what the law says, if people aren't convinced that doing something is the right thing, then they're not going to do it when no one's watching. No different than seatbelt usage. We can't get seatbelt usage up to where it needs to be unless people honestly believe that it is saving lives. And I think we've gotten to that place culturally, and we need to get to a place culturally here in Michigan where people understand the science and believe in the science that masking and social distancing works.
Yep.
Brian, I might add that, oh, go ahead, Ray.
Yeah, no, I was just going to make two quick comments, Jerry. First, I completely agree with Brian's perspective, and to the reporter who asked the question. I would say that while we do see mask usage in many places, there are pockets where there's not good compliance, and so in the Henry Ford system, our Henry Ford Macomb Hospital has the highest volume by far. It has twice the inpatient volume that Henry Ford Hospital has, and Henry Ford Hospital has more than 2 times the number of beds that exist in the Henry Ford Macomb Hospital. My team tells me that on a very regular basis in the Macomb community, there isn't good compliance with mask wearing. We see that not only in our facility with, at times, visitors who would come into the facility challenging our staff around our mask use policy, but also in that community. And so I do think there are communities around the state where there is not good compliance. And I think that people have to remember one other thing, which is unfortunate about the coronavirus, and that is 40+%. The science tells us that 40+% of individuals who are positive are asymptomatic. And so one of the issues that I think people still do not acknowledge is that your friend or family member or coworker can be right next to you looking completely healthy and sound and be positive and shedding the virus and potentially infecting you or others. And so that's the reason why mask wearing is so important, is because we're dealing with a virus that at times is sort of the silent attacker. And so that's I think a point that's really important for the general community to understand.
I was going to add that leaders of the state's large businesses continue to meet around this topic as well. All of them are seeing a significant rise in cases amongst their employee populations, but they all do contact tracing as well. And the vast majority of the cases are coming out of social situations or family situations. Sometimes large gatherings, but more and more we're seeing gatherings of 6, 8, 10 people across boundaries of families and friends that has one symptomatic person or one asymptomatic person that spreads to the rest of the group. And that really seems to be the mechanism. So masks, yes, hand washing, yes, but we've really got to take it the next level of care in the way we socialize. That's the only way to say it. We just can't freely socialize, even in modest sized groups, the way we have been, without continuing to accelerate this spread.
So my second question is about the state legislature or the governor's office. Are there things that you think that state legislature could enact in order to help the situation and minimize the spread?
Well, maybe I'll jump in, and then if one of the healthcare leaders wants to join. I think that this press conference was organized primarily so you could hear directly from healthcare leaders just how serious this is. I think, as I said earlier, we've watched other governments take steps, and oftentimes the steps taken by government, they do 2 things. One is that they impose restrictions, but the second is that they send a signal to the public that the state of affairs has gotten to a point that's very, very serious. And you often see that the curves in those countries bend over the top as both the case levels rise and those sorts of new restrictions come into place. We aren't here today to talk about what we recommend for state government. We're here today to let the hospital leaders speak, but I think it's would not be surprising if folks in state government are watching this pace of increase and thinking about what they need to do to intercept it.
And we've talked about the things that we all can do to slow the spread, wearing a mask, washing our hands, and social distancing. There's a few other things that we've actually put in place in our facilities to keep our team members healthy. And those are things like removing chairs from tables and asking people not to eat with other people because that's a time where you have to pull your mask off, and then that's a greater risk situation. There's other opportunities. Instead of going out in groups to a grocery store, maybe it's one person should go to the grocery store. It's just rethinking what we were doing earlier in the year when it was a lower positivity rate. Now that it's higher, we just need to understand that there's a greater risk of, as Wright said, this silent and invisible virus that is around us, and lower that rate so then we can get back to doing some of those things in a safe way.
The only other point I'd add, and I think it was a point that Brian Peters raised, is, one of the challenges I think we face in our Northern Michigan rural communities, people know each other. They're comfortable with each other, they're friends, they're family. And there is this perception that if I know somebody and I'm just getting together with those friends, they couldn't possibly have this. And as I think Wright said, given that so much of this is asymptomatic, we need to get a message out that this isn't about who you know. It's not about your friends. You have to assume, the numbers I look at, if we have a 12% positivity rate right now, that 12% or more of the people that you're in a meeting with or sitting down with dinner with may have this. And to change the mindset of just because you know somebody, just because they're friends, doesn't mean that you shouldn't be cautious.
Thank you. Next is Kristen Shamus from the Free Press.
Thanks so much for taking my question today. This comes back to staffing and knowing that Michigan can't really draw from other regions of the country because they're also seeing a huge surge. We can't draw from other regions of the state because the entire state is now embroiled in this. What will you do if it gets to a point where you don't have enough staff to care for all the patients who are flooding your hospitals? What's the plan?
For us, the plan really, we have contingency plans for all of our hospitals where we will have to pull back on non-COVID services at some point. Do not want to do that. Do not think that's in the patient's best interest, but that is definitely where we will have to go. I will tell you, and I think Tina Fries-Decker made a critical point earlier about the staff that is different than our first surge. For us in Southeast Michigan, I'll pick on Beaumont, we went from 0 to over 1,200 COVID inpatients in 3 weeks. And we really got through that first surge with a lot of adrenaline. And this pandemic has now turned into a marathon. And in terms of the amount of energy we've got, with our own staff, our frontline caregivers to manage through this, we got to be very careful with them and very respectful of their potential for exhaustion around this. But I would say that probably everybody on this phone from the healthcare side, we all have contingency plans, and we don't want to have to deprive patients of non-COVID related critical services or get into that trying to select, patient A over patient B. But that's the difficulty you can get into. And again, we control this virus as a population, and if we all work on it, we can really get to a better place and hopefully relatively quickly.
I agree with what John said, and we have contingency plans. We've also done training. So on the chance that we need to pull somebody into an ICU or into another area, we've done training to help them be better prepared for that, to relearn the skills that they may have had at one point. The unknown with some of this is because it is spreading in the community. Our staff are getting it by just being with their family, and the connections that they may go out in the community. So that's one of the things that that we're trying to manage, is when those come up, how do we fill those holes, and what does that mean in terms of our staffing plan?
Yeah, this is right at Henry Ford. I would just echo what John and Tina have said. We have the same kinds of contingency plans in place. And the short answer is, if we begin to be overwhelmed from an inpatient perspective with COVID patients, we have to limit other services and reallocate staff. As Tina just indicated, we've done the same kinds of things with providing training for staff to be more cross-functional in their ability to provide support during scenarios like this. And so I think you can just rest assured that the healthcare community is prepared in the event of a crisis. We practice crisis management on a fairly regular basis. And so we're prepared to redeploy our teams as necessary to take care of critically ill patients. We just simply want to be able to take care of, the full panoply of needs of the state. So we want to provide care for COVID patients and then all the other needs that our communities have.
Thank you. I'm going to merge two of the questions that are in the chat here. One's from Justin Hicks from MLive, one is from WDIV. Are you seeing more problems with hospital bed space? What is your level of concern over your own staff getting sick? Are you seeing a higher level of staff getting COVID?
I think we've covered some of these questions. That's, staff is one of the critical areas that we're most concerned about. And so we monitor that on a regular basis. All of our team members are required to do the symptom checker review before they come into work, and they all understand the benefit and of PPE. It does work. It does protect them as they come in. So they're doing their very best. And our conversation today is wanting to have our communities continue to help us and our team members care for not just COVID patients within our hospitals, but all people in our communities who have healthcare needs.
Yeah, one of the points I'd like to emphasize on staffing is, and I think this will be true throughout most systems, we know that our PPE works. And if you look at staff that have tested positive, the vast majority are receiving that through community transmission. And so naturally, like teachers, like other professions, as the positivity rate goes up in the community, that impacts our staff. But I want the communities to know that coming to a hospital is safe. The amount of transmission within the hospital is very low because we have now, different than back in March and April, I think a more adequate supply of PPE. So this is a community issue, not an issue of spread within a hospital.
Thank you. Another question from the chat here is regarding expanded burden on emergency rooms. Can you expand on that at all? And what does that look like for patients and staff?
I'll speak from the Beaumont perspective. We are seeing more COVID-related patients coming through our ERs, where it's really grown dramatically. We now have about 25 urgent care centers through the metro area, and they are seeing 40% growth in terms of their volume. So clearly the communities are looking for access to care, to get COVID testing, or potentially to handle COVID-related symptoms. And that is very much happening, but it is impacting our ERs, but the stunning growth has been in urgent care.
Thank you. I'm going to try to get through as many of these questions as I can. Brian Peters, this one is specifically for you. Any information on how many of your members as of today have already decided to delay elective services?
Appreciate the question. And the way we get at the data around issues such as that is primarily through our chief medical officer group. And we've been meeting with them on a weekly basis giving us insights into their surge capacity plans and their status. And so when it comes to delaying elective care, really there's only one facility in the entire state that we are aware of at this time that's even talked about doing that in the days ahead as a potential. And so our data would show that's not occurring across the state at this point. But as I think you've heard very clearly from our members on the call today, we'll do that if it's absolutely necessary. But the reality is we want to make sure our doors are open for those who need healthcare services to the extent possible. And so, again, we're trying to do everything we possibly can to avoid that outcome. I would just tell you one last tool in the toolbox that has not been mentioned today in terms of keeping our frontline caregivers safe. And frankly, it's a tool for all Michiganders, and that is the flu vaccine. And we are calling on all of our hospital employees to be vaccinated for a traditional flu this year. We don't want to have that double whammy, if you will, of a COVID surge and a flu surge. And so again, for Michiganders who are able, we certainly call on you to get your flu vaccine as well.
In addition to what Brian said, what's different from last year is we didn't have the PPE. Now we have the PPE. So it's not a matter of being able to protect our team members for surgeries. So what we're doing is we're actually moving more and more surgeries to an outpatient setting where we wouldn't be using an inpatient bed and we wouldn't be using the inpatient staff. That allows us to be better prepared, expand our traditional capacity to serve our community. I do think that on a case-by-case basis, we are looking at certain surgeries to understand, will that impact our capacity? And if it doesn't harm our patients in the short term, that is a strategy that we are considering. But it's really about each patient and each person's individual situation and how does that impact them and how does that impact then the organization.
Thank you. Next is Vicki Thomas.
Hi, good morning, and thank you all for doing this. I have so many questions, but I'll try to narrow it down. Basically, the headline from what you all are saying this morning is that if the community doesn't step up, that we could possibly see a situation that is much more serious when it comes to a public health crisis than what we saw back in the spring. That's number one for anyone who wants to tackle that one.
I think you summarized it very well. It's what's driving this now is community spread. It's our behaviors that drive it. And the infection control tools are very basic, very simple. It's not 23 things you have to do. If you do 3 things very consistently, you can really bend the curve on this in a very positive way. And we need everyone's help to do that. If we don't do it, there will be all sorts of consequences for our communities that we don't want to go through. We don't want to go back into the spring of this year when it really was getting to be a very difficult situation. The healthcare system can capsize if you don't keep it under control. We're ready to dedicate, as much as we need to helping COVID patients, but it's not unlimited. And that's what we all need to be mindful of.
All right, great. And can you all, I'm just curious, tell us how and when you all came together to really sound the alarm on this?
Well, let me maybe take the first shot at it as chair of the Michigan Hospital Association. I think one of the things that is unique about Michigan is the relationship that the hospitals have with each other before this pandemic. And I think that allowed us to have conversations about situations, how we work together, and what this means across the state, maybe better than other states where the hospitals don't have a similar relationship. So I would say we have been working together as hospitals and health systems from the very beginning in March and continue to do that on a weekly or daily basis. And I think that really helps address this throughout the state.
I certainly echo Ed's comments, and I would just add that we are having conversations with each other frankly, multiple times a week, certainly weekly in some formal settings, just checking in with each other and seeing how things are going in our various markets. So, as Ed said, there's a great sense of collaboration amongst the healthcare leaders in the state, and so we've been coming together related to this for many months, just specifically around COVID. But even when COVID's not the issue, there are other things that brings us together fairly regularly to talk about how to work together.
And it's not us as CEOs, it's our lab team, it's our chief medical officers, it's our supply chain officers, our chief nursing officers. Every single one in our health systems are connected with everybody else. And that's, to me, one of the true values of being here in Michigan. The collaboration really comes out. And that's, again, our call to action here is we have to do this together. We see this spreading across the state, and we know that we can get this under control, but we need everybody's help to do this because it does impact every community right now.
And lastly, I'm sure that the governor is pretty frustrated. She's tried to stay on top of, the spread of COVID. Do you have any advice for her, or are there any things that you think the governor could do to make some headway?
I'll just jump in. I think it's the governor needs to try to work with the legislature as much as she possibly can. I think she's doing it to try to get this more tightly coordinated on the state level. And I think that would be very useful. I think she has been an advocate for a good Michigan response to COVID since the start of the pandemic. But like I said, we're now into a marathon and we really need to stay at it. And I really hope our government officials listen to what we're saying, process that, and come out with new approaches that'll help all of us in Michigan bend the curve on this infection rate and put this genie back in the bottle.
This is going to end up being our last question. It's regarding contact tracing from Justin Hicks at MLive. Have we gotten to the point in this surge of cases where contact tracing is no longer effective or less useful as it was over the summer?
I think contact tracing is still very useful, but I think part of this is we need to cooperate with the health department and others that are calling because right now we know that people are not willing to share who they were with or potentially follow the guidelines of a quarantine or isolation. And I think those two things could continue to help us slow this curve by doing that. Again, this is one where we need to be all in this together. You can contract COVID. It's I don't think there should be shame in that. People shouldn't be feel guilty about doing that. It's a virus. It's invisible. You can do your very best, and I know people have done their very best, and they still got it. But the next step is how do we help contribute to the solution? How do we continue to slow this spread? And so it is important that if you do have it, you take the actions to quarantine to keep yourself separate from others, that you do cooperate with the health departments or others when we're calling them to do the contact tracing, and that you share that you help people understand the importance of that.
I would agree with Tina. I do believe that contact tracing remains a very important tool in our toolbox. And I would just point to an announcement made by the Michigan Department of Health and Human Services earlier this week, launching the My COVID Alert app. And that's something that employers and others can utilize. It's voluntary, of course, but I think that's a good way to use technology to engage in this contact tracing.
And Brian, I might add that there's a group of us that get together weekly, and included in that is local public health. And the report from local public health this past week was that it's a staffing issue for contact tracing too. And the available staff right now is becoming overwhelmed. And so they used to be able to trace 80 to 90% of issues within a single day, and that's plummeting. It's down to 60% and falling. And so as the number of cases rises quickly, their ability to do the contact tracing is falling. And as these healthcare leaders have said, it's vital to control the spread, but it also becomes more difficult. I guess a couple of thoughts I'd add before we wrap up that I think the press, frankly, could be helpful with is that there is an attitude that I think exists where this disease is spreading most in the state, which is in small social settings. That yes, we need to comply with masks when we're in the grocery store and so forth, but when we're in a group of 8 or 10 people, even if it crosses boundaries, we're not going to wear a mask. I mean, we're not going to do that when we socialize. But that's one thing when your positivity rate is 2 or 3%. It's quite different when your positivity rate is 15 or 20%, because in that group of 5 people, the likelihood is there's one who is a carrier and will spread the disease. And that's why it's spreading so rapidly. So I think, and I don't know if we'll convince people to be in masks in small social settings, which just means they need to be a lot more careful about who they choose to socialize with. And they need to keep that very contained to groups that don't cross a lot of boundaries continuously. Or if we do that, we will not slow the spread of this. The other thing we haven't talked about today is mortality rates. Case fatality rates in the very recent past were 20% for people in their 80s and 8% for people in their 70s and significant 2 to 3% for people in their 60s. And we continue to see significant fatality rates in our medical institutions. And that really brings home, just ultimately as these case levels rise, how serious this is for Michigan. And I don't know if any of the healthcare leaders want to wrap up with either thoughts on those things or final thoughts before we sign off.
We appreciate the support, the help. Again, we're extremely grateful for our physicians, our nurses, our caregivers, for everything that they are doing within our health facilities to help people stay healthy. We're grateful for our community to join with us together on this, and with an emphasis on what Jerry just said. It's going to take all of us to slow this spread, but that's what we need right now, so that we can see, the finish line of this marathon. We know it will be here, but we just need to stay with it, stay strong a little bit longer as we get through this.
I would agree. I think, my only we are all in this together, as Tina just alluded to. And if we all stay at it, if the media helps, we do our part, all of our community gatherings, I think we have a chance again to put this genie back in the bottle and bend this curve.
Yeah, Jerry, I would just end with certainly agreeing with Tina and John's comments, and would just say that others have said this is a marathon, not a sprint. We need to stay vigilant through the winter, and then I think we can have success if we do the things we've talked about. And we thank the media for your support, and we obviously thank all the frontline workers across all of our systems that are working hard every day.
Great. Well, thank you very much, Andrea. Thanks for your help in coordinating this, and thanks to the members of the media who joined us. And we'll call this wrapped up. Much appreciated.
Thank you all.
Thank you all.
Thank you.
Thank you.